Hello everyone. I hope that you're doing well and staying safe. This month, leaders from across the system came together for our first virtual collaboration forum via Zoom. I want to give you an update on what we discussed, what's ahead, and most importantly, how this impacts you. Prior to the emergence of the COVID-19 pandemic, we unveiled our plans for the 2020 system competency, active and effective listening. We recently announced the winner of the T-shirt slogan contest around listening. More than 500 of you voted for the winning entry, which was listening with our ears, eyes, and our heart. Thanks to Veronica Teal from the Learning Management System for her creativity. I'd like to stay with the elements of this message for just a moment. Ears, eyes, and heart. Even during this challenging year, we've stayed true to our goal of listening to you, and we have heard you. Through the 2,000 questions to the COVID-19 email and the 5,000 phone calls to the command center, we've heard your suggestions and your concerns, and we take them very seriously. I also want you to know what I've seen with my own eyes. I've seen bravery. I've seen dogged determination to take care of our patients, their families, and each other. And lastly, every day you have shown up with your heart, always in the right place to care for the children who need us and the community who is counting on us. It humbles me when I think about how you have responded to the most unique time in Cook Children's 100+ year history. Thank you. Now, I'd like to give you a brief update on where we stand in our fight against COVID-19. These numbers are impactful, but because of you, they have never been overwhelming. We have met all of them head on and seen our challenges as opportunities. So what's ahead? Only time will tell. I could repeat that phrase over and over again when it comes to this pandemic, as we still have so much to learn about this virus. After all, it's only a few months old, and we aren't sure when a vaccine will be created or when we will see our numbers decline. Our best scientists and doctors from around the world are working night and day to develop a vaccine for COVID-19. But for now, we don't have one. Simply put, science is playing catch up. But that doesn't mean we are helpless against COVID-19. Far from it. Here are 5 ways that you can help. Commit to our COVID-19 safety principles. Prepare and plan ahead. Remember our promise. Be patient and understanding. And most of all, be kind. Let's look at that first bullet. Commit to our COVID-19 safety principles. You can help stop the spread of COVID-19 by committing to the basics around safety, which are in place to protect you and those around you. Yes, I want you to mask up to help stop the spread of COVID-19. I think Cook Children's doctor said it best. Let's watch our new public service announcement that you may have seen on your local TV station.
At Cook Children's, we know if we work together, we can keep each other healthy.
Wearing a mask keeps droplets from your nose and mouth trapped so you don't spread viruses to others.
Wear a mask when you're going to be around people outside of your immediate family.
Avoid large gatherings and wash your hands a lot.
These simple steps can limit the spread of viruses.
Let's all do our part to keep our community healthy.
That's right. By doing 5 simple things, you can help fight COVID-19. Always wear your mask, stay 6 feet apart, and this includes lunch and breaks with your coworkers. Clean your work areas and anything you touch more often, and wash your hands a lot. There are other ways you can help Cook Children's during this time too. Next, you can plan ahead. If you have been home during this time, please start planning now for how you will return to work. The leadership team and our board have supported our employees every minute of this pandemic. We didn't hesitate for a moment to pay everyone at their full pay from the beginning of this crisis in March and through the end of September. Right now, September 1st is our target date to bring most everyone back on site, but that could always change. Until then, if you have been working at home or differently during this crisis, you should expect to hear from your manager by August 1st about where you will be going on September the 1st. That could be returning to where you were working before COVID-19, staying at home and continuing to work from there, spending some time working at home and some time working at a Cook Children's location, a hybrid role, or something else. If you haven't heard from your manager by now, ask him or her about their plans for you. Please be flexible and accept assignments and work arrangements that may be different than what you did prior to COVID-19. For example, some of you may be called upon to work in our new testing and screening locations. Everything is constantly changing and we are always reevaluating. Well, just about everything. Stay in touch with your manager during this time as we move closer to September. Your coworkers need you, our community needs you, and our young patients need you. After all, you are essential, and we don't have the option to close. For a century, this community has depended on us for the very best health care for their children. I'm asking you to accept the challenge when you are called, and this will hopefully be a little easier by making contingency plans for childcare and your family now. Next, let's remember our promise. I mentioned earlier about listening. We hear you and we understand your concerns about returning to work. As an essential business, our patients and families are counting on us to be ready when they need us, and that means staying true to our promise. I want to reassure you that your safety and well-being remain a top priority for all of us, and we are taking every precaution to thoughtfully and carefully bring you back safely so we can care for every child who needs us. We are following all local, state, and national guidelines around building capacities, gatherings, social distancing, cleaning protocols, and more. Another way you can help is by being patient and understanding. We started employee testing this month, and Occupational Health has been working around the clock to respond to all of you. If you need to reach out to Occupational Health, please use their new email address shown on the screen and avoid calling. And while nothing has been business as usual for the past 4 months, we are making it. We are making it because of all of you and that sense of togetherness. We've seen that same sense of community throughout the state. The Children's Hospital Association of Texas, or CHAT, have joined together to assure the public that hospitals have the capacity and ability to keep kids while COVID-19 cases and hospitalizations are increasing in some areas of Texas. In addition, I talk regularly with other CEOs from children's hospitals from across the country to ensure we are united in providing safe care. And as we plan as a country how we can safely reopen schools, I want to thank and recognize Dr. Mark Mizade and the 50 other Cook Children's physicians who created the recommendations for the practical, fair, and safe reopening of public schools K through 12 in the state of Texas. These recommendations and guidelines are being used by the state of Texas and the American Academy of Pediatrics. I also want to thank Bobby Feather, our Senior Vice President of Public Policy, for working tirelessly to keep us updated on the latest regulations and policies from Austin and DC. Bobby has helped us to not only stay in the loop, but in the middle of the conversation when it comes to our hospital receiving the proper funding we need to help all of our patient families. Speaking of funding, during this time, it's more important than ever to be careful with our finances and good stewards of our resources. Let's check in with Stephen Kimmel, our Executive Vice President for Finance. Stephen does such a great job of explaining such complex numbers in a way we all can understand. Stephen, tell us how things are going during COVID-19.
The initial coordinated response to COVID-19 in mid-March resulted in significant volume decreases for Cook, very consistent with decreases experienced by other systems. However, as each subsequent month has passed, volumes have improved to where they are only 15% lower than historical levels. We expect continued improvements, although the future rate of improvement will be slower, with the longer-term impact being volumes 10% lower than historical levels. Decreases in volume inevitably result in lower revenues. At the same time, costs increased as the system addressed the needs for PPE, supplies, and other resources to safely provide health care to our patients. The decrease in revenue and increased costs decreased our operating margin. The impact on the operating margin was most pronounced in April, but has improved in each subsequent month as volumes have increased. In addition to the improvements driven by volume, financial performance of the system has been positively impacted by improved Cook Children's Health Plan performance, along with federal funding received from the CARES Act Provider Relief Fund. We expect that the financial performance of the system will remain at lower than normal levels for some time as a result of the effects of COVID-19. However, given volumes at or above current levels, the resulting financial performance will be adequate and sustainable. Cook has a long history of solid financial performance, which has allowed the system to save and accumulate financial resources to help in difficult times such as these. The resulting financial strength as we entered into the pandemic allowed Cook to be patient and measured in our response. That strength allowed for decisions that provided certainty and financial stability to all of us that are a part of the system. There will most certainly be additional challenges related to COVID-19 that have financial implications, but we are well positioned to respond appropriately. I know you will be thoughtful in your use of resources to leave Cook in a strong financial position, well prepared to endure the next crisis. I feel fortunate to be here at Cook and to work with exceptional people like you that make Cook Children's a special place for the children we are trusted to care for. I hope you feel the same. Thank you for your flexibility, patience, and compassion during these uncertain times. Thank you for making Cook Children's special.
Thank you, Stephen. That was a great update. We appreciate everything the finance team does for Cook Children's. And now I have one more way we all can help out during this time, and that's by simply being extra kind to everyone we encounter. You all know the phrase, a little kindness goes a long way. Our country is experiencing some transformative changes, and emotions and energies have been at an all-time high these last few months. Together, we can make a difference for our patients and families if we remember everyone is going through a struggle and are in need of our empathy, understanding, and a little extra kindness. I've been so inspired by how you've responded to these life-changing events this year, and I've watched you display kindness all along the way. Keep that up. Yes, we are living in historic and unsettling times where everything seems to be changing by the minute. Even in the midst of a global pandemic, you have proven that we can meet any challenge that comes our way because we are Cook Children's, and we will get through this together. Thank you for your commitment to our patient families and each other, and please know I appreciate every single one of you.